In this video, I'm going to talk about biomedical therapies. Biomedical therapy is a treatment that involves medication or medical procedures to treat or manage psychological disorders. Biomedical therapies fall into several approaches and may consist of drug therapy, shock therapy, surgical treatments, or non-invasive stimulation. The first biomedical therapy I'm going to discuss is psychopharmacology. Psychopharmacology is the study of substances that influence mental states. Such agents induce changes in mood, sensation, thinking, or behavior. Psychopharmacology encompasses medications used in the treatment of such conditions as depression, anxiety, psychosis, and mood disorders. I'm going to talk about the 4 basic types of drugs used to treat psychological disorders. The typical or conventional antipsychotics were first developed in the 1950s. Haldol and Thorazine are the best known typical antipsychotics. They continue to be useful in the treatment of severe psychosis and behavioral problems when newer medications are ineffective. These drugs work by blocking certain dopamine receptors in the brain and reducing the effect of dopamine in synaptic transmission. Antipsychotic drugs or antipsychotics are a type of psychiatric medication which are available on prescription to treat psychosis, such as hallucinations, delusions, and bizarre behavior.
My name is Jasper, and I live with paranoid schizophrenia. When I have episodes of hallucinations, I hear loud voices very close to my ear. It's almost like a whisper, but it's loud. I've also seen shadows on the walls that come along with the voices like a monster clawing across the wall. This medication has helped me with the hallucinations such as the voices. And the shadows that I see on occasions, I still hear voices. It's in a language that I can't understand. And there's another voice that tells me I'm useless and worthless. I take clozapine every morning to cope.
The traditional anti-anxiety drugs are the minor tranquilizers or the benzodiazepines, such as Xanax, Ativan, and Valium. These drugs work in reducing anxiety by increasing the concentration of neurotransmitters such as serotonin, norepinephrine, and dopamine. Anti-anxiety drugs are medications used to treat generalized anxiety disorder that causes excessive worry and anxiety and significant distress that affects the ability of a person to function.
My name is Juno, and I live with social anxiety. Social situations make me really anxious. My hands and legs shake, and I feel really red as if I'm sweating. And I feel like I look really weird. I'm unable to communicate properly, and I cannot keep eye contact with people. I just tend to look down. My medication, Ativan, helps me with my social anxiety.
Mood stabilizing drugs is a treatment of choice has been lithium. It is a metallic chemical element that in its salt form that is called lithium carbonate. Mood stabilizer drugs are commonly used to treat people with bipolar mood disorder and sometimes with borderline personality disorder.
My name is Jana, and I live with bipolar disorder. Being bipolar means my highs can be really great and my lows are very terrifying. I talk fast a lot, as if I feel like a superhero. It is something that is so oppressive, and I can do literally nothing about it. When I was first diagnosed, I wanted to do it without medication, but it turned out it was too difficult. Being bipolar means that I'm characterized by mood swings. It can range from having all the energy in the world, and the next, I can't even get out of bed. This mood stabilizer medicine called Effexor is the only bipolar medication I take during the day. But if I miss it, I start feeling horrible.
SSRIs or selective serotonin reuptake inhibitors are the most commonly prescribed class of antidepressants. It works by balancing certain chemicals in your brain called neurotransmitter by decreasing serotonin reuptake in your brain. Antidepressant used to treat major depressive disorder and other mental health conditions.
My name is Bailey and I live with major depressive disorder. I always had this feeling that something terrible was gonna happen and that presented itself with tightness in my chest. I would get really shaky, I would have a lot of stomach pain, and around middle school, I started to get depressed and it progressively got worse as I got into high school. Everything just seemed kind of gray and I felt worthless. I don't have anything to offer. I started to feel heavy. I started to self-harm. As a way to cope, I started having suicidal ideation and tell my mom, I don't think I can keep myself safe anymore. I don't know what else to do. I feel stuck. I know I need help. I take Prozac to help improve my mood, help me sleep better, and increase my appetite and concentration.
ECT is a procedure in which small electric currents are passed through the brain, intentionally triggering a brief seizures and a release of a flood of neurotransmitters in the brain. ECT is used not only in severe cases of depressions that have not responded to any drug treatments, but also in the treatment of several other severe disorders such as schizophrenia and severe mania that are not responding to alternate treatments.
Electroconvulsive therapy, or ECT, is often called a treatment of last resort for patients who haven't had success with drug therapies, who have life-threatening psychiatric conditions, or who are suffering a catatonic state. ECT induces a brief seizure in a patient which resets the brain functions associated with some psychiatric disorders.
It's typically indicated for treatment-resistant psychiatric conditions, most commonly mood disorders or depression, but there are multiple types of depression, so it can also be used to treat bipolar depression.
The majority of ECT treatments are managed like outpatient procedures, and the patient is given general anesthesia.
Another approach of biomedical therapies is psychosurgery. It involves cutting into the brain to remove or destroy brain tissue for the purpose of relieving symptoms of mental disorders. One of the earliest psychosurgical techniques is the lobotomy. It was used to treat mental and neurological illnesses, including schizophrenia, bipolar disorder, and epilepsy.
Ever not do at home. These two tools were used by a Dr. Walter Freeman. In fact, he had them manufactured. One's a pick, one's a hammer. What are they for? Lobotomy, for a transorbital lobotomy. The way you did this was to stick the pick just above the eye in the orbit into the skull, into the brain, with a few taps of the mallet, and stir it around a bit. The idea was to destroy that part of the brain that might lead to hyper-emotional responses and aggressive behavior in people who are mentally ill. This was a fad for a period of time, and almost as quickly as it became a fad, it stopped when other physicians said there really wasn't a scientific basis for this.
Another emerging approach is RTMS, or repeated transcranial magnetic stimulation. It is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depressions. TMS is typically used when other depression treatments haven't been effective.
I realized that this wasn't a feeling that was going away. The treatment that I received was absolutely simple. They just put something against my forehead and it took 3 minutes.
TMS stands for transcranial magnetic stimulation. It's also referred to as repetitive, or RTMS, which is repetitive transcranial magnetic stimulation. And the machine uses a magnetic field to generate activity in neurons, something known as action potential. And so the idea is that we're promoting a process known as neuroplasticity, which is the synchronization of neurons, getting them to fire more actively over time. And when neurons fire together over time, they tend to fire in healthier ways.